Eddie Cabray here with Cabray Plastic Surgery. Today's patient story, never too old for nerve transfers question. So this is a 73-year-old right-hand dominant woman who presented to my clinic with a 1-year history of a complete right PIN palsy. Now she had radiation treatment to her right axilla in association with breast conservation therapy and had stable PIN palsy now for a year that followed this radiation treatment. Here she is in the preoperative setting. Here's her examination.
We're here in the area, anticipation for FCR branch to PIN transfer. Okay, can you extend your wrist back? Excellent, and relax, good. You can relax back down, okay? I'm gonna hold your wrist. Can you straighten your fingers out? Fingers up, and then relax. Maybe make a fist, yep, and then straighten them out. Straighten them out.
So you can appreciate she's got no active finger extension there, but normal wrist extension as would be expected. So we had a conversation about tendon transfers and nerve transfers. I decided with her to proceed with the nerve transfer of the FCR branch of the median nerve to the PIN branch of the radial nerve. This is what it looked like in surgery. This is the donor nerve, the median nerve dissected out. You can appreciate the FCR branch, the median nerve proper, and the AIN, the anterior interosseous nerve. Here is the intraoperative donor selection evaluation.
Intraoperative evaluation of donors from the median nerve. You can see the median nerve here proper, the AIN. And we've identified the FCR branch. I'm going to stimulate FCR and we're going to watch out at the hand to confirm our donor. And there's FCR branch stimulating and relaxing, stimulating and relaxing.
So after our donor dissection, I then proceed to the radial nerve, the target nerve dissection. You can appreciate here the radial sensory nerve, the extensor carpi radialis branch, and extensor carpi radialis brevis branch, and the PIN. And here's that target nerve evaluation intraoperatively.
Target nerve dissection, radial nerve, radial sensory branch here, ECRB and ECRL branches here. Stimulation here results in wrist extension. Here's our PIN stimulation, nothing. Radial sensory, nothing, and ECRB branches here. See nice wrist.
And you can appreciate that on stimulation of the PIN, there's no clinical response, which is consistent. So the FCR branch is divided from the median nerve. The PIN branch is divided from the radial nerve in preparation for coaptation, as shown here. Microsurgical coaptation is performed in a tension-free fashion. And here she is at about 13 months postoperatively.
So we're now 13 months, over a year out, FCR to PIN nerve transfer. And can you straighten your fingers out? Straighten them out as you can. Excellent, okay, and relax, good. I'm supporting your wrist so you can't kind of cheat here. And then straighten them out again for me, straighten them out. Wonderful, and then down and straighten them out. Perfect. Anything, what about your thumb? Any thumb? Thumb, not really anything there. And then your fingers again, straighten them out. Beautiful. Okay, great.
So I hope you enjoyed this case of never too old for nerve transfers question. I think this case challenges a lot of the traditional teaching out there about age cutoffs that are somewhat arbitrary when considering nerve procedures. Certainly we know from the literature that younger patients do better, but it still requires some nuanced decision making. And I think as this case illustrates, you can still have excellent outcomes with patients that don't fall in the traditional age ranges. A couple of quick points about her. She's thrilled with her results. She states that this has radically changed her ability to do activities of daily living. She can button buttons, grasp and release objects. But notice she didn't get anything back from her thumb. And so in my practice now, when I'm doing this transfer, I'm often doing this in conjunction with an AIN to the deep branch of the PIN through a dorsal-only approach in a combined fashion, as described by Bertelli. And so in this patient, I can still perform a tendon transfer such as Palmaris Longus to EPL to give her thumb function. As always, make sure your surgeon's board certified. Ask for pre-op and post-op pictures. We'll see you for the next patient story.